My name is Ken Hekman. Welcome to this course called 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague, Quinton Friesen, and I are leading you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. This is Module 8 of 15. As we continue thinking about the discipline of management, we are ready to turn toward the question of how we organize people to achieve our plans. Organizational structures may not capture our attention easily, but they can define the difference between efficiency and wastefulness, between confusion and order, and they can impact patient safety and the quality of care. Physician leaders especially need to pay attention to how people are organized to work together and how decisions are to be made if they are to preserve the quality of care. Without clear lines of authority, clarity about decision rights, and strong communication, people flounder trying to do their work while crying out for leadership and guidance. In this module, our learning objectives are to understand the basic design qualities for efficient and effective organizational structures, begin to discern workforce requirements and selection techniques, understand how to build job descriptions and work standards for organizational achievement.
Let's begin by looking at qualities of efficient and effective organizations. Ken, what are the marks of a well-organized healthcare organization?
The first mark of an efficient and effective organization is that everyone knows where they fit in the organizational structure and how they relate to others. Each person knows to whom they report and where to go if they need guidance to do their job. If the janitor needed to go to the administrator each time he needed additional supplies, both the janitor and the administrator would be inefficient in the use of their time. So the janitor needs to know who his supervisor is, and the supervisor should have the authority to resupply the janitor promptly so the janitorial work can continue without delay. Second, organizational development professionals have studied highly complex organizations and have generally concluded that flat organizational structures are more efficient. That is to say, that the fewer layers of decision makers, the better, because then workers on the front lines don't have to depend on a long and complicated process to get a decision made. The most effective organizations minimize the number of higher-level managers, both to keep costs down and to simplify decision-making processes. A third principle to consider in designing an efficient organization is the span of control, which is a measure of how many people each manager can manage effectively. Research and experience has taught us that a guiding principle is to structure one manager for about every 8 to 20 workers. Highly independent workers, such as physicians, might require less of a supervisor than lower skilled workers. Under this model, supervisors might be working supervisors who are involved in task performance as well as supervisory responsibilities.
What other principles lead to efficiency in organizations?
Another principle for efficiency and effectiveness is to train people so that decisions can be made at the lowest level at which they can be competently performed. Managers need to carefully think about what we call decision rights, that is, who has the right to make each type of decision. Going back to the example of the janitor's supervisor may have the right to order supplies when they reach a certain order point, but the supervisor may not have the right to change to a more expensive supply alternative or to switch to a different vendor. Those rights might be reserved for the supervisor's manager. Decision rights help to keep the flow of supplies and other resources going smoothly without letting the costs of those supplies get out of hand. Efficient and effective organizations also depend on communication systems that allow the free flow of information between heads of departments and the leadership team. If managers don't communicate with each other, or if they don't trust the leadership team with vital information, managers may replicate services, waste resources, withhold information that could cause a safety problem, or make decisions that are contrary to the overall goals of the organization. Good lines of communication can prevent waste and streamline solutions when problems arise.
Now let's turn our attention to workforce planning. Managing people may be one of the most challenging tasks of healthcare managers. But one of the first dimensions of that challenge comes in determining how many people are needed in each department. Goals and dreams are often greater than what budgets will allow. So the role of a healthcare manager is to find the balance between needs and resources in each area of the hospital, clinic, or healthcare organization. Finding that balance may be based on regulatory requirements, industry research, a task analysis, or departmental strategies. Let's take a closer look at each of these dynamics.
Regulatory requirements. Regulations might require certain staffing ratios in some departments. For example, a nursing home may be required to have each nursing assistant responsible for no more than 10 patients on the day shift.
Industry research. In mature markets, hospital associations may publish survey data about average staffing ratios in various hospital departments. Such research can be helpful as an initial guideline, but managers will still need to discern their own departmental requirements based on a more comprehensive understanding of their unique needs and context.
Task analysis. In some cases, managers may want to carefully examine the detailed tasks that need to be performed in a department to evaluate how many people are required and what competencies each person needs to master to meet departmental goals.
Departmental strategies and priorities. Upper-level managers may sometimes need to adjust departmental staffing levels based on changing strategies and priorities for the healthcare organization as a whole. For example, if demand for services is growing in cardiology but shrinking in pediatrics, hospital leaders may decide to transfer and retrain some pediatric nurses so they can be effective in the cardiology department.
Analyzing tasks can be a time-consuming process, but it can yield excellent insights about the efficiency and effectiveness of staffing levels within a department. Task analysis requires a detailed review of the processes for accomplishing tasks. With each task, managers can ask questions like these. How much time is required to accomplish the task? Are the steps required to accomplish the task logical and in the best sequence? Do people have the right tools they need to accomplish the task most efficiently and effectively? Does the staff know how to use the tools in the most effective way? Has everyone been trained properly? When patient safety is at stake, is everyone aware of the safety standards? And is a checklist used to ensure their compliance? How can we improve quality and reduce costs by accomplishing each part of each task differently?
Healthcare managers who do not objectively evaluate workforce requirements may find themselves under pressure to add staff on the basis of emotional appeals. It is not uncommon for workers to complain about being overworked. Complaints may also grow when departments face changing expectations or unexpected growth. Healthcare managers need to be prepared to train new people and retrain existing staff as workload requirements change over time. They will also need to create a culture that values flexibility, cross-training, and mutual respect for everyone in the department. That way, managers can resist the argument of, "That's not in my job description."
One of the fundamental building blocks for a well-organized staff is the job description. Job descriptions simply outline responsibilities for each person. They should include the title, the responsibilities, tasks, or roles that the person is expected to perform, the title of their supervisor, and standards of performance. This last item, standards of performance, is frequently absent in job descriptions. Healthcare managers should go beyond a simple list of basic tasks to set standards of what good work looks like with each task. Describe what the end result looks like for a job well done. Without these standards, many employees will believe that they are doing a good job if there is no complaint about their work. Use the job description to go beyond the absence of complaints as an indicator of good performance. Outline the consequences for both high achievement and low achievement. As a manager, your job is to help each worker be successful. The job description, and especially the performance standards, can be a valuable tool to assure their success and the success of your department.
Let's talk about some common questions that emerge from discussions about organizing. Why do we need organizational charts when everyone already knows their job?
Roles and responsibilities may be clear to everyone this month, but workforces are constantly changing. Next month, a long-term employee may leave, or a new employee may join the team. The organizational chart can serve as a tool for quickly making adjustments in staffing, for orienting new employees, and for maintaining good communication between all employees. A periodic review of the organizational chart is a good idea to make sure everyone understands how decisions are to be made most efficiently and effectively.
Ken, isn't it more efficient to just go to the top when I see a problem that needs to be fixed?
No. The top leader may not be as accessible to you as your immediate supervisor, so you may spend more time and effort trying to get the top leader's attention than is necessary to reach a good solution. Likewise, each leader needs to establish their own priorities for their time and energy, and the problem you identify may not fit their priorities as well as they would fit the priorities of your immediate supervisor. That concludes the module on organizing. By now, I hope it is clear that designing an organizational structure can spell the difference between an efficient organization and one that wastes time and resources. Healthcare managers need to make the best use of every resource and to assure patient safety and improving quality of care. Wise organizational structures, sound decision-making processes, and clear job descriptions are all significant building blocks for creating high-quality medical services. Here is an exercise to help you apply the principles in this module. Draw an organizational chart of your organization and critique it with questions like these. Is the span of control reasonable? How can the decision-making process be simplified? Are reporting relationships clear and logical? That concludes Module 8 of 15. Thank you for participating.